Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada.
Hi, everyone, and thanks for joining us again on Action on Pain podcast. It's really great for us to be back in the studio. Over the summer, I personally was off for nearly 2 months, traveling by RV with my wife and the dog across beautiful Canada. We went literally coast to coast. And as part of that, I had the pleasure of dropping in and seeing in person both Jen and Virginia. So it was a great trip and a great opportunity to see these two amazing people in person, which any chance I get to do that is always an honor. So we're glad to be back, and we're ready to go with another episode today. So Jen, I'll turn it over to you.
Oh, well, thank you. And it was so special to see you and your wife and meet our mascot, Parker. So that was really wonderful. And I can say that today I'm joining from the University Hospital of Montreal. We're here. It's a very, very impressive place. And I'm in the research center at the hospital here. So I'm in a bit of an unusual setting, but it's a beautiful spot and inspiring.
Nice.
Today, we have the pleasure of welcoming Mary Brachaniec. She's joining us from her home. And just to give you a little bit of an idea of why it's so important to speak with Mary today, she's an amazing person. And following her career in physiotherapy, Mary has served as a volunteer with the Arthritis Association on the provincial and national levels, and as a Canadian Institute of Health Research ambassador from 2004 to 2010. Mary's a patient partner with the Canadian Institutes of Health Research Chronic Pain Network and a caring partner of the University of Regina Pain in Older Adults research team. Mary has lived with widespread chronic pain from inflammatory arthritis for over 30 years, which she says has changed her life. But it has also provided her with many rich opportunities as an advocate. We're so eager to hear her insights today as they relate to goal number 2, to improve access to timely, evidence-informed pain care, education from all impacted by persistent pain, as well as goal number 4, which is carrying out a high-level research that improves care and outcomes for people with chronic pain. It is such a pleasure to welcome you here today, Mary. Thank you.
Yeah, Mary, I must say it is a pleasure, Virginia here. And I must say it was a pleasure to see Keith in Nova Scotia. And I can't, the list of things that Jennifer had explained to you and living with inflammatory arthritis, and you're able to do all these things is very impressive. As one maritime to another, and I'm in Nova Scotia, and I know you're in New Brunswick. I understand it says you had 20 years as a pain advocate, improving understanding, prevention, and equitable management of chronic pain. Can you tell us a little more how you actually became involved in pain advocacy?
Well, my roles with pain education and advocacy, and then the research side of things as well, I would say it's been kind of convoluted. I got involved to begin with the Arthritis Society because that's really who I associated with the most. And I started as a self-management program leader way back.
Oh, wow.
And and then a master trainer. So I taught other leaders, and I actually got a lot out of it. It really inspired me, and I thought, well, I can't be leading these classes and teaching them if I'm not actually kind of living self-management and doing it and taking care of myself. So It wasn't only good, it was good for me, but it was good for me to get really connected. So from there, I went to the provincial board, and then chairing the provincial board, and then on the national board, and then on the executive, and then leading a lot of the education that the National Association Society was doing. So that was pretty well between 2004 and 2014, I'd say. And then what happened was I was invited to a conference, and it was a research conference. And it was an Arthritis Society research conference that had stakeholders from all across Canada. And the task was to set the research agenda in inflammatory arthritis. So there'd be patients and policymakers and physicians and physios and a whole bunch of people that worked or lived with arthritis. And so we came together, and there was a series of decision-making rounds where everybody had the input, and we decided it, and we, reduced the list of research priorities. So I think we brought it down to 10. And then organizations like the Arthritis Society and Canadian Institutes of Health Research and an organization called the Canadian Arthritis Network, they funded those 10 research priorities that we had set. So it really made a difference. So we could go and we could put in our input, and then we could see that research teams from across Canada would get funded to do the research. And that's when I got really excited about research.
Mhm.
So that's kind of when although I kept up with the Arthritis Society and those other roles for probably 6 or 7 years, sort of both, I did them both. But then I kind of went down the research path, and I can, tell you about that as well. But I don't want to go beyond that question that you started with.
I just want to jump in there
Okay,
and,
then.
and just I just love the fact that over 20 years ago you were like actively in self-management, because there's not a lot of people who even knew what that was back then. So I think that's really, really interesting. And I just love the fact that your path took you into research. Personally, from my end, my story is a little bit like yours. Once I got into research, I'm like, this is the greatest stuff ever. And I just want to keep doing this because I'm a great big nerd. So yeah, thanks.
I feel
Thanks
the
for
same
sharing
way
that
about
story.
research.
Yeah. Yeah.
I think we share this in common, if I'm not mistaken, because it has driven a certain amount of passion in each one of us, right?
Yeah.
And
Yeah.
and what's striking to me, Mary, is that you like, in addition to the self management, which is like so key, continues to be, but also it's been a number of years since you were first engaged as a patient in research.
Yeah.
That's quite remarkable, because that's always a work in progress in terms of ensuring that patients are engaged in research,
Yeah.
because nothing about us without us,
Yeah,
right?
exactly. And way back
Yeah.
in
So how?
2004.
I
So
I
what
yeah.
happened
Yeah.
was I went from that conference and I met a couple of people who were just inviting patients with the different kinds of conditions that the Institute of Musculoskeletal Health and Arthritis did research in. So bones, muscles, joints, oral health and rehab and that kind of thing. So I was invited to become a research ambassador with a knowledge exchange task force. And that task
Mm.
force is still going. But when we were doing it,
Hmm.
we didn't have any idea what we were doing, really.
Yeah.
It was just so new. Patient engagement was really, really new. And so was knowledge translation, that whole field. It
Yeah.
was just being defined back then. Ian Graham from CIHR and some big names like that, they were just starting with, hey, we do this research, but it doesn't actually often change practice. It takes at least 17
17.
years,
Yeah.
right?
Hmm.
For
Sadly,
that,
yeah.
yeah. So
Hmm.
that was kind of the push, that if we brought patients and health professionals and others into the research field, that we could be more relevant in terms of what research we do. And then once we do that research and we work together on it, then we can together get those results out to the people who need it and maybe make that research actually change something, change practice. So that's kind of so I was with them for, I think, from 2004 to 2010. And then that was my term, but I was energized by that as well. And we did some work in pain back then. And what happened was we were asked, all of us research ambassadors, mostly patients, with the Arthritis Society and the Canadian Arthritis Patient Alliance. I was trying to represent them on the task force. But what happened was, one of the meetings we had, they asked us all to pick what's called a Cochrane systematic review
Hmm.
and
Yep.
help
Yep.
Hmm.
share the results of that review with the people who need to know.
Hmm.
Because oftentimes people don't, they don't find out the results of these So Cochrane, it's a really kind of neat group because it's teams of researchers and patients and health professionals and librarians who get together and they find all of the research published in any one area. So it could be, does splinting help keep range of motion of the joints in rheumatoid arthritis and hands? So it could be that. My group picked some systematic reviews on exercise and fibromyalgia, and we thought, oh, this is a good one because we can try to reach the Canadian public and Canadian patients.
Yeah.
Because, it showed that exercise was helpful in fibromyalgia. But so that was what we did. And we started a project and we worked with the authors of this review. But just before we were ready to share the results, we had all kinds of ways of sharing them. We had pamphlets and we had little taped things that we were hoping to send out by email and other ways and websites. They redid the review and the results were not as significant. So anyway, to make a long story short, we stayed with that another patient partner, Janet Gunderson. And I went and stayed on that Cochrane team for 6 or 7 years as we did we did a review on flexibility and stretching exercises and one on aerobic exercises and one on strengthening. And we published them all. And then we had like a plan to share that information widely.
That's amazing. And I'm listening to this and I'm thinking, I know when I got involved in research, and it's only like 6, 7 years ago, it was still like trying to break through a concrete wall. Meanwhile, here you are years before, you have cleared the forest for us to come along, and most of us didn't know about it. So that's amazing.
Wow.
And I can't imagine the obstacles either at the time.
Well, we were just kind of going at it step by step.
Wow.
And we had so much encouragement because there was, at the Cochrane, for example, the Cochrane systematic reviews of all the different reviews that are published. And the public has access to these reviews through our public, well, many of us through our public libraries. We can all have we can all see the summary. And some of us can see the whole review from our library websites and things. But what happened was we had come up with a plan to share the results of the 4 or 5 different reviews to do with exercise. And Cochrane had a World Congress every year. And so we wrote up an abstract and we were the leads, the patients, at I think it was an hour and a half workshop at one of the global Cochrane congresses and we had people in the room from all over the world. And we had, okay, this is our evidence. How would it be best shared in your country and in your country?
Wow.
And that kind of thing. So that was really, really interesting. That was in 2013.
Oh my God. I just didn't know that was happening back then. That's incredible.
Yeah.
That's great.
So, but then I ended up kind of going off for a while because I wasn't doing so well. And Janet stayed on that team for quite a bit longer than I did. But it was very, very interesting. And I know that Cochrane has quite a well-established group of, they call them consumers with Cochrane, but it's really the same as patient representatives in our language.
Same in Australia, the consumers, considered consumers. Yeah, it's interesting.
Yeah.
Yeah. Very interesting. Mary, I swear every time I talk to you, I learn something or so much more. And this sort of, it's so remarkable to know, like what Keith was saying earlier, that you've been involved in these things like from way back, and yet patient engagement continues to be something that is worked on actively, and so it's so nice to know that there were successes.
And it's so rewarding to kind of sit back and to see how much is being done and to read some of the publications in PE and Jennifer and you, both of you, all three of you, some of the work that you've done. It's amazing.
Well, you
takes a village.
You set the table for that. Yeah. You set the table for that to happen. I mean, unbeknownst to me, that work you were doing, going back a couple of decades,
Yeah.
allowed these doors to be open. And so, some of the challenges that I don't want to speak for Virginia and Jen, but I will. But I think that we felt when we were trying to get into research, you had already broken down a lot of those barriers. So you
Yeah.
made it easier for us to get in to do what we've been doing recently. So thank you for
Yeah.
And there's still
Thank you
ways
so
to
much.
go, but it's
Oh, there is
much
a ways to
appreciated.
go.
Yeah.
And
that.
there was an
But if it
organization.
wasn't for groundbreaking.
Yes, and
yeah.
there was a
Yeah.
group called the Canadian Arthritis Network too, and they did a lot of work in arthritis, but it's
Yeah.
the nothing about us without us,
Yes. Yeah.
And I think we
Yes.
all have that mantra, and it really it gets us out of bed in the morning sometimes if we're not feeling that well, and it really, and I think it just really keeps us going, right? Because we see what the
Well
results
said.
are.
Absolutely.
Well said.
Yeah.
And speaking of sort of results and so on and progress, I'm wondering, Mary, if you could tell us about how the action plan on pain in Canada has affected your life, and in particular, the goal number 2 and number 4 or number 4. Can you share with the listeners a little bit about the work you've done prior
Sure.
to Health Canada Action Plan for Pain, how you think it's affected your life and work?
Okay.
Yeah.
Well, and I'm going back again a little bit because the chronic pain network that I became a patient partner with, and really I had taken another step back in the last couple of years. My husband was sick, and so I haven't done a lot with CPN lately, but I'm due to go to the conference in a couple of months and hopefully get my hand back in. But
For the
through
Chronic Pain
through the
Network,
chronic
CPN.
pain
Yeah.
network,
Yep.
yeah.
Nice.
So
Nice.
part of the chronic pain network, so it's a Canadian Institutes of Health Research network, and the network funded, I think it was 19 university-based research projects from across Canada. And this was way back in 2016 or so, 2016, 17. And each of us, patient partners on or with the Chronic Pain Network, we were all asked to pick one of the projects that was going on in Canada and become a patient partner specifically with that team. And so I had parents, who were getting older. And I thought, well, pain is a big problem with seniors. And they were starting to have some pain issues. So I became familiar with the work of Dr. Thomas Agistaropoulos from the University of Regina. And he was doing research. He is doing research still relating to pain in older adults. So Thomas and I got together on the phone and we talked about, what could I do for his team and, what he would want me to do and what I could do. And it just became a great partnership right from the beginning.
Nice.
And I did a few things sort of generally with pain, like working on some of their projects and participants, recruiting participants and that kind of thing. But I became really, really involved in his dementia and pain assessment program. And basically, he observed that people with dementia who lose their ability to talk and to communicate well, that they can be having pain, because we know that about 70% of people in long-term care have pain of some sort, but they can't tell you they have pain.
Right.
And
Yeah.
so you could have someone who develops a toothache or an abscess, and if they can't tell you they're having pain, they might start to act out. Their behavior might change.
Right. Yeah.
And it may not be picked up that it's from pain. It might be misattributed to, some kind of a psychiatric disturbance, and they might be medicated for that. And all the while that they're having pain. So, they suffer. And that to me was just like beyond, like it's bad enough to have, when we all manage our pain from day to day, but if you couldn't, and your voice was taken away. So that really resonated with me. And it did, especially by this time, because then my parents both had dementia. And, I was thinking, oh no, and they went into long-term care. And I I was right on it as a past physio, like to be observing and making sure that they weren't suffering. But on the other hand, knowing that lots of people were. So Thomas and his team had developed an assessment tool that can be done by caregivers. It doesn't have to be health professionals. It can be done by caregivers, family members. And if it's done regularly, then they can pick up a change.
Really?
And
Impressive.
yeah. And if they pick up the change, the idea is then you let the health professional know. And then they do a more detailed assessment and hopefully pick up on whatever the problem is. So Thomas had done this work. It was the assessment tool was translated into a number of languages and picked up in various places around the world. So, and he's a leader in the field. But basically, it wasn't really being used in Canada very much. And so then we looked at that 17-year gap and we thought of all those people in 17 years who might be having pain. So what we did was we did these knowledge translation projects. So we wanted to get the word out, like this is how you can assess pain. This is how you assess it. This is how you manage it. So we had a website with all the information on it. And then we had a teaching video. And then we did a Twitter campaign.
I remember that. That just hit like crazy.
I know.
It's amazing.
Yeah. It was based on a Twitter campaign that the Children's Hospital in Halifax had done, Dr. Christine Chambers. Doesn't have to hurt. So ours was see pain more clearly. And in 6 months, we had over 50,000 views of the video. And we had 5,750 visits to the website from 55 countries.
Wow.
So that was pretty good. So what we did after that was we got more money, we got some funding. And we were able to, and that was through the Saskatchewan Patient-Oriented Research Skipper Network. So we had funding to hire a digital marketing campaign. So we had 4 videos for different groups, like health professionals had one, policymakers had another, patients had another. And we had 250,000 views on our web of the video and over 60,000 views to the website. And we were really, really, really happy with that.
Yeah.
We still don't know how much it changed. It actually changed practice. So someday that could be a focus of the team to actually do knowledge translation and then measure the true impact of how much it changed, how much it changed outcomes for the residents of people with dementia. So basically, I'm almost kind of circling back now to the second priority, the second action plan about care for people with pain. And what happened around that time was right after the pandemic. And a group called Health Standards Organization, HSO, it develops standards for healthcare in Canada. And those standards are used by an organization called Accreditation Canada to accredit our hospitals and our long-term care centers. So basically all long-term care centers in Canada, or at least most of them, in the provinces that require the accreditation, most of them do, and all hospitals, a team will go in and they'll have, this is what we expect you to be doing in order for you to be licensed to practice, kind of thing. So they were getting together a team to write the new national standards for long-term care. And since I'd just been a caregiver for my parents, and I was pretty excited about the pain research that we had been doing, I thought, well, I'm going to apply. And it was a team of 32 people from across Canada. And I made it. So I was on that team. It was a real honor because basically the standard was published in 2023 and it provides evidence-informed, resident-centered care that values compassion, respect, dignity, trust, and meaningful quality of life. And it has content relating to pain. And so that was something that actually changed practice. We know it changes practice because they don't get accredited if they don't meet these requirements. So that was really, for me, that was my full circle moment. And it was just, I was really honored to be part of that group.
And how fortunate are they to have had you on there? I can hear how meaningful it is and has been for you. But when I look at the two goals that you were focused on, you were improving access to timely evidence-based informed pain care, educating about persistent pain, and in this case around the senior dementia community, and then also carrying out truly high quality research that has been exposed internationally.
Yeah.
It's phenomenal to have been a part of that.
It's been a part, and if I look back at my physiotherapy, I loved being a physiotherapist. I absolutely loved it. It was the right career for me, but I could only change one life at a time.
Right.
And so I kind of think, I would have kept doing that. I would have kept working as a physiotherapist, but it was difficult for me with the physical challenges. But I've just gotten so much joy out of all of this. And, I have kind of gone in and out a few times, but volunteering, it allows that. It allows us to be not great sometimes.
Yeah. Yeah. Well, Mary, that is truly fascinating, beyond fascinating, because I learned so much about the trailblazing work that you did. And so I've decided I'm going to put your face up on my wall and I'm going to be more like Mary, because she's been a trendsetter and a trailblazer. So you're going to continue to fuel my passion. So
what would Mary do?
Right.
Oh, stop. Well, look, I was so surprised when I got this invitation, because sometimes you feel like you're just, because I haven't actually been to conferences or anything for a while. Right. I've been doing a lot of this sort of in my own little world, and it really means a lot to me that you've invited me here today.
It's an honor that you joined us, because what you're doing really matters, and you've taken the time to explain to us so much that we didn't know. So
thank you very much.
Yeah, thank you.
And we'd like to also thank you, Mary, but we'd like to also thank all of you who are tuning in to the Action on Pain podcast today. We hope this episode has shed some light on the important work being done in Canada as guided by Health Canada's An Action Plan for Pain in Canada. Until next time, thank you, Mary.
Thank you.
Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.